Good afternoon, everyone. Welcome to our second day of summer course of child nutritional aspects in coastal region of Diponegoro University. And we already have among us Dr. Doddy Izwardi. I think he is present already. Good afternoon, Pak Irwadi, Pak Doddy Izwardi,
Yeah.
Mr. Doddy Izwardi. Good afternoon.
Yeah, good afternoon, Pak Mas Adrian. Yeah.
Yeah. So thank you for coming, for being present in our. Oh, sorry. Yeah. Thank you for being present in our second day of summer course. So, but first, let me change my background. So, Dr. Doddy, how are you?
Fine, thank you, Pak Adrian. Yeah, thank you very much.
And thank you for also for being our speaker in the middle of your business. Yeah, I know because Dr. Doddy currently is the chief of research center of nutrition and public health in Ministry of Health, Republic of Indonesia. And he was a former of our director of empowerment nutrition of Ministry of Health. So I know he is very busy, but thank you very much for being our speaker today. So perhaps I will start first by introducing you from your CV, because it's important to know that Mr. Doddy was graduated from the Interprofessional Health and Community Care from Vermont University. Is correct, Mr. Doddy?
Vermont University.
Yeah, Vermont University. So
United Kingdom.
Yeah, in United Kingdom. And in 2017, I think he was the director of community nutrition in Ministry of Health, Republic of Indonesia. And present, he is the chief or head of research and in nutrition and public health of Ministry of Health, Republic of Indonesia. And today he will talk about the determinant of stunting and also a nutrition problem in Indonesian children, but from the perspective of evidence-based or the data that has been analyzed and also published from Indonesian community. Yeah. Perhaps you may start your presentation, Mr. Doddy. Could you share your presentation, please?
Yes, I will. Yeah, this one.
Yeah, perfect. We are still waiting to see your presentation.
Yeah.
Okay. Yes. Please, Mr. Doddy, you can start the lecture. The time is yours.
Okay. Thank you very much, Pak Adrian. Thank you for the invitation to teach in the summer course at the University of Diponegoro. And then good afternoon all the participants in the summer course. I think ASEAN country and all ASEAN. I hope this is the information with I started to tell about the journey of accelerating stunting reduction in Indonesia. because
for your information, we also have a participant from European and also from another other continental. That's
other
just the
continental.
information. Okay. So very interesting, Mr. Doddy.
Okay, yeah. I'm sorry, Pak. Yeah, because all the participants in the world, I think, in the European country, in the continental, and this afternoon. Yeah. I hope my presentation. This is the new informations because for a long time ago, I'm a former director of public health nutrition in Ministry of Health, 2013. Yeah, this is the prevalence of stunting is very high, same prevalent like the African country, because you know that in Indonesia is the growing with the least developed country. However, how is still a problem with the stunting. I will tell you about the journey, the astral stunting in Indonesia, because I will start in the outline. I hope, yeah, because I quite difficult to explain because stunting is the big problem. Stunting, talking about the disciplinary, and then to multi-sector to invite together, yeah, multi-sector together. This is important. I hope this my presentation. This is perspective of Indonesia, understanding malnutrition. Yeah, this is we causes and the consequences. Stunting management approach in Indonesia, multi-sector role. Yeah, because I want to definitely look at this because the lot of a problem, lot of the impact from the human resources, especially when the stunting. This is the what can do we talk with the multi-sector roles, and then conclusion. I hope this to your informations the next what can do in Indonesia, and then all the participants look at the program stunting in Indonesia. We look at this because global regulations for malnutrition in the Lancet series, the 2012 World Health Assembly endorsed 40% reduction in the number of stunted under 5 children to 2025. Now is 2021, still 4 years. Yeah, this is what can do in Indonesia. What can do my president, vice president, to talk with the to 2025, because we targeted, president targeted 40%, 2014. Yeah, this is the ambitious because not easy to reduction of prevention. And then we look at this so long, a commitment that was reinforced the target 2.2 of the Sustainable Development Goals by 2030, which explicitly outlined the global pledge to reduce the prevalence of child stunting. Despite this long-standing target, we are not on track to reach them. Yeah. Because this is the good time, 2025 and 2030. Previous Lancet have liked the importance of optimizing childhood nutrition for survival, because many things, Lancet series, the Lancet 2013 Lancet, yeah, I'm a director in October to my Minister of Health to give me responsible reduction stunting, maternal and child nutrition series estimated that scaling up of set of 10 evidence-based nutrition specific intervention to 80% coverage in 30 focus countries, with 90% of the global stunting burden could result in a 20.6% stunting reduction. This is I want to introduce the introduction. This is important thing the last, because the yellow determinant and the risk associated with concurrent stunting and wasting also merit examination. because linear growth faltering is not the only issue affecting health, well-being, and vulnerable population. Why we choose stunting, not just the wasting. We look at the wasting is responsible only for the Ministry of Health. For a long time ago, since 1997, in the economic crisis. Yeah, this is I give you the next presentation. This is the global regulation for malnutrition and the land sharing. And then we talk Indonesia off track on track the target. This is important thing for the other country. We look at this on track or the off track because not easy. Yeah, because the ambitious from the 2025 and the 2023. Yeah, and this is important thing. We look at this the progress, and then we look at this impact the stunting, impact the stunting for health first. This is the second impact for the population of growth. Yeah, and the third impact of the economic. My president, yeah, Pak Joko Widodo, potential economic returns for stunting reduction investment in Indonesia time 48 times. This is the momentum. If you want to the human resources, the quality, this is important thing for the impact of economy. Yeah, this is from the Hardinat et al. 2013. This is the many things country model benefit cost ratio for $1 investment to reduce stunting in selected high burden countries from Nepal, Kenya, Bangladesh, Nigeria, Vietnam, and India, Philippines, Indonesia. This is already to investment. And then we know for long the program, yeah, because the impact of health, this is the stunted growth, low birth weight, small short term. This is the problem one. And then the second, cognitive and motoric development barriers. Yeah, this is important thing what can do to the quality from the human resources in Indonesia. This is the cognitive and motoric development. However, in the next future, only Indonesia is not to become a developed country. Yeah. Because cognitive and motoric disorder. Yeah. And then metabolic disorder in adult, risk of non-communicable disease. My job in the research and development, in the public health effort, and then we are responsible communicable disease and non-communicable disease. Yeah. The big task from my job in the Ministry of Health to look at this, the stunted growth, cognitive motoric, and metabolic disorder. This is the important thing for what can do first in the strategy in the impact of stunting. And then all health policymaker, yeah. And then on Indonesia policymaker, look at this. Oh my God, this is the problem of the impact of stunting of health, stunting of population growth, because 2030 and 25, 100 years Indonesia to celebrations. Yeah, this is we look at this the same with the under 5 and the reproductive health. Yeah, this is important thing, the potential. And if we will, yeah, if we fail in the struggling with problem with the 2023, 2025, yeah, this is important thing from the start in the why the impact of stunting. I'm first because I'm already learned in Peru. Yeah, I first need to learn in Peru. Peru is the population is 30 million. Yeah, Indonesia 10 times the Peru. Peru is the good thing, the good time to example lesson learned. Yeah, because the 50% reduction in just 8 years. This is the the same strategy from Indonesia. Yeah. For example, provide the poor, yeah, with free health insurance. Indonesia health insurance, free health insurance for the poor people. The same. Yeah, this is the program. Yeah, we look at this. We have same the Peru to a 50% reduction in just 8%. Provide conditional cash transfer. Indonesia give the cash transfer, especially for the pandemic COVID, to reduce extreme poverty, and then improve the quality and frequency of preventive healthcare, family planning. Yeah, change the regulation in Indonesia for women and provide nutrition, hygiene, education for expecting a new mother and poor and rural areas. This is a lesson from the Peru country. Yeah, because we facilitated the Ministry of Health, Ministry of Finance, because Ibu Sri Mulyani before the managing director of bank, look at this. Oh, this is the stunting reduction in Peru is good because the World Bank to push in the program in the Peru. And then this is we look at it. How did the Peru achieve to get outcome in stunting areas? Yeah, because the policy recognized the relevance of multisectoral, multidimension, and approach to the problem of malnutrition. This is the UNICEF and WHO 2030 conceptual frame. Yeah, we look at this. This is the Peru, and then we look at this Indonesia as a prioritized and integral nutrition policy. Yeah, were three fundamental stages for the consolidation of the policy. Indonesia will start 2013. Yeah, this is the new government 2014 before the former president Pak Bambang Susilo Bambang Yudhoyono, and the next president 2014. This is the fundamental. Yeah, and then Minister of Health. I'm former director of nutrition to talk with to initiative the stunting program. Why the stunting program? Because not easy to explain the stunting program. Not easy, yeah, because it is impact all the impact related with the poverty. Yeah, this is the program, and then stunting children and stunting look at this the remarkable outcome. This is the good example. The short in the other country, yeah, because I want to look at this. For example, like West Java, total number population, how many total population in Java Island, Sumatra Island. This is the regionalism. Look at this from the activity. Yeah, the next slide I will use presentation this, and then why we look at this. Yeah, summarizing some lesson learned, political support and engagement, all money, planning and budgeting from the president. Yeah, from the House Representative Legislative, political support and engagement, multi-sector approach. Role the Ministry of Finance, because the Ministry of Finance have give the money from the good effort in the city, in the district, and the village. Yeah, this is the very important. Role of communication strategies, education of nutrition, yeah, research-based approach, yeah, and incentive system. This is my Ministry of Finance already have give the money, a lot of in the district, and then in the city and the villages. Evidence-based, contextual and the service delivery model. This is, I look at this, a good example, the same, yeah, is different total number population. Yeah, a different one in the Peru. Stunting not political. Indonesia, a lot of political. This is the very hard argue and debate, discuss with the many stakeholder. However, my leadership president, visionary my president, to stick with the stunting program, the major project the #1 priority in Indonesia. We still to the understanding malnutrition. Yeah, we look at this. Yeah, this is my regional report. I'm to one writer in the ASEAN volume. Yeah, we look at this the form because we'll talk not only stunting. Yeah, we'll talk the malnutrition because malnutrition to talk with undernutrition and overnutrition. This is step by step to understood why stunting. Oh, okay, understand undernutrition is the underweight. This is the wasting. This is the anthropometric measurement, wasting, stunting, and then we have a triple burden is Indonesia. We have problem with the undernutrition. We have problem the micronutrient deficiency. We have problem with the overnutrition. This is Indonesia is completed with the tackling malnutrition. This is important thing with the all participants. I give this is the regional report because I'm argue and discuss more in depth with the ASEAN country, the volume 2 with regional report of nutrition security. This is the conceptual framework of malnutrition. Yeah, this is the we look at this the activity, the consequences. Yeah, because the consequences the stunting. This is non-communicable disease and then disability and then the loss economic cognitive. This is the consequences to explain with the policymaker. Oh, what is problem? Yeah, we look at this because some overnutrition unbalanced intakes because the impact from the under 5 not good for the adequate food become to overnutrition, become to non-communicable disease. This is we look at this metadata, for example, like the conceptual from understanding with the causes and the consequences, the framework, the malnutrition. The one for example, yeah, this is the because I met Simpson and Rock in Jakarta in 2014, the double burden of malnutrition, a review global evidence. This is look at this. For example, the causes and effect on the double burden of malnutrition across the life course of an individual. Yeah, for example, we look at this. Yeah, baby low birth weight. Yeah, this is the pathway from the World Health Assembly to target global 2025. The first problem, the low birth weight. This is the higher mortality. The higher mortality is the relevant with the stunted and then relevant from the baby for the mortality. How the problem? Yeah, this is the increased risk adult chronic disease. Yeah, for example, like that the program, and then inadequate length growth. Yeah, because this is the food consumption, especially for the poor breastfeeding, practice and frequent infection. Yeah, this is we look at this poor breastfeeding because exclusive breastfeeding. My research in the basic research still low. Yeah, because 2013 36% and 2018 only increased 1%, 37%. If look at the target global, off track of non-off track, yeah, this is the off track because this is the target is not 50% for the exclusive breastfeeding. And then all the young child stunted, yeah, accelerated growth, yeah, and then adolescents, teenage pregnancy, malnourished a mother. This is the we got one example causes, and I hope we talk with the many things the policymaker, many things the stakeholder. Not easy for understood. What can do? Oh, this is one a problem. If the baby give not good, the high quality food, the problem with the overnutrition. Yeah, this is the life cycle, intergeneration life cycle with the problem of Indonesia. Yeah, because Simpson and Rock, we discuss more in depth. We look at this. We will start the program stunting in Indonesia. For example, the Indonesia. we look at this prevalence of stunted age 5 80 years by SEC Basic Research 23. Look at this. This is we look at why very high the age, male or female, 11 years old and 12 years old and 30 years old, because I look at this. This is a tendency for the prevalence to increase at the age of the 7 years as for boy, and at the end of the 15 years for girl, they can be attributed to the impact of economic crisis. And then I already to give my all stakeholder, be careful with the pandemic COVID. Indonesia the experience, because the economic crisis in 1980-2000s, where most of the children in that age group were born. We look at this, This is the prevalence stunted at the age 2013 until 2028 basic research. We look at this female stagnant. This is the 25% and the 25%. This is stagnant, not program from the adolescents. We chose the new generation program, adolescent nutrition. We hope this to, because 1,000 Day for Life and the program, the adolescent nutrition for the teenage. This is important thing. Because we look at this problem, the female stunted. This is a problem with the intergeneration for the baby. This is the stunting reduction and trend to target. The president already give to statement 40%, and then 25 until 26% per year. This is ambitious. I know ambitious. However, we have problem the COVID-19, 2020 and 2021, because no anthropometric measurement data 2020. Waiting for SSG. My progress. I'm still in the pandemic COVID. We research all district Indonesia, almost 500 district Indonesia in the pandemic COVID, and then 80% respond rate now. I'm waiting for I'm waiting for a problem with the pandemic COVID, because Java Bali Island too close to anthropometric, and then now is the good effort with the tackling the pandemic COVID. We open the start with the anthropometric measurement to study in 2021. I hope in October I explain you what the data. The data now is the 27.67, because the 2013 28%, almost to reduction with the in 2013 until 2019. We look at this problem, the COVID, and then we look at the president still 40%. What could the wasting? Because wasting 1.5% to stunted. This wasting is the acute malnutrition, and then the stunted is the chronic. This is the different to treatment, different to intervention with the stunting recognition, wasting reduction trends and target. If the good effort with the stunted, I hope the good effort for the wasting. Because the all measurement look at this. This is the one slide to a good point for the all participants. Because problem with the 1998 and 2000 until 13 years to impact with the teenager Indonesia, and still stagnant in female. And female now, I think the merit and for the babies, this is the problem with the next future for the from the female pregnant married. This is the situation 50%, because the total population adolescent Indonesia is 40 million. I think the half, the 40 million problem with the stunted in the program. This is what can do in the 2013. This is the review child stunting and determinant in Indonesia. This is the explore the meta-analysis, especially from the all research in Indonesia, and then data from the 2013 to explore. Some important determinant factors occurs stunting in Indonesia. This is the not easy for look at. Baby is not exclusive breastfeed, premature birth, baby born short, lack of access to health services, inadequate access to latrine and drinking water, low household economic status, live in the countryside, low maternal education, short mother. Yeah, this is 25% to the data from the basic research. Yeah, this is important. Look at this program with the review child stunting determinant in Indonesia, and we with the mapping research set, we give me to the how the important determinant factor stunting, because we want to know. Then I give the all stakeholder, I give the policymaker many things. The policymaker, oh, this is the problem with the factor occur stunting in Indonesia. This is, we look at this important thing to breaking the chain of stunting in the family. We already talked with the many things, the critical period of growth. This is 1,000 day of life. For a long time, yeah, this is the so long with the critical period of growth, because always stagnant, yeah, because the data stagnant in Indonesia, because only focus with the critical period of growth. Yeah, this is, look at these important things for the pregnant mother, building the potential for rapid increase in the cell number, building potential for weight, rapid increase in the cell size. This is need the micronutrient and protein, need calories. However, this is the from the pregnant mother, not enough recommended dietary allowance from the pregnant mother. Yeah, this is the problem. And then to a birth to 2 years, this is the stunted. Yeah, achieving potential for height and weight, need micronutrient, protein, and calories. However, this is the critical period. And we look at the data. Yeah, we intergenerational of growth failure data. Yeah, we look at this low birth weight. Yeah, 6.2%. Long birth weight 20%. Yeah, this is only low birth weight baby weight and height. Yeah, we look at this, and then we look at this, the child growth failure. Yeah, stunted is the 21.5 until 37.2%. Wasting and of obesity. Yeah, this is the child growth failure. This is the international of growth failure. Look at this, what the problem. Yeah, low weight and high adolescence, small adult woman. Yeah, this is, we look at this teenage pregnancy. The problem with a problem with the Indonesia. And then if we give situation from the international, we give the current condition of adolescent impact of future children, because we know that the prenatal care and maternal health during adolescent pregnancy, the pregnancy with the analysis in the developing world, teenage world is the increased risk maternal anemia, because we give the teenager to program iron folate acid, preterm birth and cesarean delivery program to comprehensive prenatal care to have the potential to diminish risk of many complications. This is the open window, the second window. This is to combine, to close, to breaking chain the stunting in the family, because this is the policymaker stakeholder responsible from the president, many things, the responsible, the manager, deputy, echelon 1, echelon 2 in Indonesia understood with the, okay, this is 1,000 of life, this is the adolescents from the children, give the program intervention, because we know that have the second window opportunity. If the fail in this 1,000 of alive, go to the second window of opportunity to influence developmental trajectory, shaping future habit. Yeah, this is important thing now they understood with the one activity one focus with the look at this program. This is the important thing, yeah, because stunting not easy for the to reduction in Indonesia. We talk with the multi-sector roles. Yeah, we look at this from Indonesia have committed to achieving the 6 global nutrition target by 2025. For example, stunting 40% reduction. I hope 2024, 40%. This is on track with the target. Anemia, this is the problem of Indonesia, still offset. Low birth weight, the on track or the progress, because a program with the maternal death. Childhood overweight, yeah, this is the problem with Indonesia, yeah, because the many things, the not good food in the field, and then many things the little literacy, unliteracy with the pregnant mother. This is important thing now with the food with the childhood. Breastfeeding, this is the exclusive at least 50%. Yeah, and then we Indonesia we look at this the on track with the breastfeeding. Wasting in target less than 5%, still 7% on track. This is look at this the key to success in achieving the nutrition target is the on track of off track the 6 target achievement. For example, like the meta-analysis from the journal Lancet journal. This is the exploration with the intervention specific. This is important thing with the commitment. And then we look at this. Yeah, this is we look at the poverty, intake nutrition, food ability parenting, access to health services, infection. Yeah, this is we focus the look at this. Yeah, because poverty related with the stunting the anemia teenage, pregnant mother, chronic lack of energy teenage and pregnant mother. This is we look at this the program. This is the data. Yeah, data is from in Bahasa. Yeah, because I look at the energy consumption, protein consumption for pregnant mother is still recommendatory of index. This is research in Ministry of Health. Yeah, it's still not good from the pregnant mother, from the anemia, chronic of lack energy. Yeah, this is the progress. Important thing for we know what can do with the reduction to acceleration with the stunting program of Indonesia, because the prediction with the stunting COVID in Indonesia, this is on the UNICEF, WHO, managing the UN system already give warning to program in the world, especially in Indonesia. We look at this. Yes, I look at the program. I hope I'm waiting my research 2021. I hope Indonesia to not problem, because the good economic from Indonesia to tackling with the poor people poverty. This the basic cause overall in the program. This is we look at the district and city stratification. Yeah, because prevalence law, this number color gray. Yeah, this red and yellow. Yeah, this gray. Yeah, the law we look at this the district and city stratified by category stunting prevalence in 2018. We look at this some good effort with the total number province, total number district and city in Indonesia. We look at this, yeah, only low in here, in all the island, and then Kalimantan Island, some district to gray. Yeah, this is all the look at this, the stratification district and city to prevalence of stunted in district and city. We look at this to talking with the stunting prevention. This is all the ministry and institutions responsible for the tackling in the program, because the related to the sustainable development goals and goal to look at this the program. Yeah, Indonesia look at this, and the Indonesia effort for the stunting prevalence. midterm plan, national midterm plan target 2024, 40%, target of 25, 40%. Yeah, I think related with the program, and then by 2030, and all form of malnutrition, including is under 2 and under 5 program. Look at this. This is the all ministry, all Indonesia to responsible for the acceleration with stunting in program. This is the look at one mini slide presentations. For example, Ministry of Health, Ministry of Social, Ministry of Ministry Education. This is the Family Planning Board, and the Food and Drug Board, yeah, and then educations. All these responsible from the program, yeah, and then to responsible from the Ministry of Industry. This is already fees and all the responsible, like the homework, home affairs, this many things, the responsible from the multi-sector approach. This is the role of multi-sector, yeah, because Indonesia start 2011 member of Scaling Up Nutrition Movement, and then to develop the role of multi-sector in tackling stunting. A government as a focal point, university, academia, business, private and philanthropy, civil society organization, partners, donor, and UN system and media. This is the what task, for example, ministry and institution, integration and synchronization, implementation of intervention, multi-stakeholder mobilization, monitoring. This is the university and professional organization, program development, training, community assistance, companies, employees, nutrition improvement, social CSR, social corporate social responsibility, civil society organization, communities education, training and monitoring, and donor technical support, study piloting and best practices. Important thing, one is media. This is dissemination of information and best practice to the community. This is the role multi-sector in tackling stunting in Indonesia. We look at this, the progress to the upstream policy and awareness 2011-2017. Upstream policy, Sun Movement of Indonesia, Indonesian joint movement in 2011, have the policy framework, implementation guideline, presidential decree 1000 of life in the 2018, launched the national movement, multi-sector and multi-stakeholder coordination structure, tracking budget allocation for nutrition. This is the progress with the look at the upstream policy and awareness. And then this is the start, yeah, because 10 health instruction of the president. This is the 2017. This is the era, the stunting program. Now, President talked, nutrition is the investment for the nation, no more severe acute malnutrition, because President still now with the wasting, 2017. And then the next 2018, President now understood the stunting program, as Indonesia has become middle income country. The President to talk with the instruction from the foundations investment with the policy investment. You have 48 times to invest in the stunting, like the Hodinot et al. To give the meta-analysis model. This is the upstream policy 2018 until 2020, strategic guideline for stunting program. This is the one book from the secretariat from the tackling stunted. This is the guideline from the Bapenas, yeah, to give the instruction, the money, tracking budget. This is the from the national strategies. This is the convergent strategies to a guideline for all the governor, mayor. This is to develop the strategic guideline. This is the stunting management guideline. Ministry of Home Affairs give the technical from the key performance at convergence from the stunting in the district and city. This is from the Ministry of Village, the guide, general guide from the cadre from the human in the village. This is the facilitations from the how to discuss with the village, because like the many things stakeholder in the village, how can they discuss with the intervention convergence in the villages. This is the household, yeah, because we know that a problem with the home, problem with the walls, sanitation, many things, problem in the village. Yeah, this is have the guideline to tools from the all multi-stakeholder activity. This is the new. The president appoints the BKKBN Family Planning Board as the head of the implementation of the acceleration of stunting prevention. Still new, on January 25, 2021, I think all the people, why the BKKBN? Yeah. Why the family planning? The president appointed the BKKBN Family Planning Board as the head of the implementation of the acceleration of stunting. Expect the prevalence of stunting to decrease by 40% in 2024, meaning it decreased 2.5% per year with only 2 years left. Yeah, this is so ambition, so hard with the all multi-stakeholder. Yeah, because president won, and then all this regulation to change the regulation. Yes, the national strategy to accelerate stunting reduction to change. Reduction stunting prevalence, still 5 pillars. One pillar, 1, 2, 3, 4, 5, 6 pillars. Number one, yes, the strategies, look at this. Increased commitment and vision before leadership, ministry and agency, provincial government. President already commitment. Vice President already commitment. Legislative House representative already commitment. And President won ministry agency to leadership, provincial government, district, and local. This is the new. And National Action Plan for Family Approach, provision of stunting risk data. And then improving the quality of preparation for family of life. The two goals, improve communication of behavior change, the community empowerment. Because we know that the family planning program for a long time ago is success with the two child. This is the good effort, improve the communication of behavior, assistance for families at risk for stunting, ensuring the fulfillment of nutritional intake, increasing the convergence of specific intervention and sensitive intervention by ministry. This is the step-by-step to convergence, all the one focus, ensuring the fulfillment of nutritional intake. And then national plan assistance for all breeds. This is the all breeds to the candidate. Yeah, this is the support for the all breeds. Yeah, because this is the ensuring the nutritional intake. This is the good from the improve the parenting. This is the important things, the improve parenting, because improving food and nutrition security at the individual, family, and community level. Yeah, because exclusive breastfeeding, the good, adequate food, this is important thing. And then to develop national action plan, surveillance of family at risk of stunting, improving access and quality of health services. This is strengthening and developing data, information, research, and innovation system. We call the stunting case audit. And then improving access to drinking water and sanitation. Yeah, this is the goals one by one to look at this new regulation. Yeah, before we look at this, what can do with the goals, pillar, and then national action plan. This is the good effort. And then we hope we will start 23 and 24 in the Vice President's Secretariat in already to the national dialogue, communicate with all together to new regulation, President Decree 70/2020 to change 42/2013. This is the new President to sign for the 6th August 2021. Conclusion, this is important thing for what can do with the what next, yeah, because we always to talk with the events. Event is the prevalence. We know that all multi-stakeholder to talk with the only focus with 40%, governor 40%, district for event, what happened? I think it's better a pattern of behavior. What sin be happen? Yeah, because the governor and then major and then responsible from the district and city and village, what's been happened? This is the pattern of behavior because Indonesia is a different island. For example, like Java Island, Sulawesi Island, and then Sumatra Island, Kalimantan Island, and then Papua and Maluku. This is the pattern of behavior. Pattern of behavior, look at this with the unseen. What is generally unseen? This is important thing. What are the trend? What change they have the occur, the goal? Yeah, because I changed the look at this, the new regulation. For example, like the surveillance of family at risk of stunting. What can do? Pattern of behavior. This is important thing, the structure of the system, because Indonesia decentralizations, yeah, health and education decentralization. This is the almost 26-year structure of the system. What has influenced at the patterns, policy, law, physical structure? Not easy. Yeah, we look this. Yeah, because the stratification 2019, we look at this. Why still gray? Why still yellow? This is the structure of the system. This important thing, the last mental model. What assumption, belief, and value do people hold about the system? Yeah, this is the iceberg model. Yeah, I look develop the iceberg model to look at this, not only to talk the events, because many things. For example, 2 days in Indonesia to talk together events. Yeah, and I look at this, the many things expert to speak, many things the governor, bupatis, and the major to talk, many things the leaders in village to talk with the events, what happened, and still what can do in the mental model. This is important things because, for example, we want to know improving parentings, yeah, in the mental model. Exclusive breastfeeding is different. The other field. This is the conclusion with the multi-stakeholder approach. Thank you very much. I hope this all for all with the Indonesian acceleration reduction stunting of Indonesia. Thank you very much.
Okay, thank you very much, Mr. Doddy Izwardi, for a very interesting presentation, because it's clear now, actually, in Indonesia, from the presentation of Dr. Doddy, we learn from Peru, and then we design, I think, right, design the multi-sector approach. But actually what Dr. Doddy has been presented is about the specific intervention related to the stunting. And for your information, for the participant information, that previously, so before 2021, how to tackle the stunting problem was led by Ministry of Health, right, Dr. Doddy? But start since January 2021, the family planning agency, the National Family Planning Agency, is given mandate by the president to lead the program related to the stunting problem. But I'm not sure. Is it already on start or ongoing, Mr. Doddy? The way of the family planning agency lead the team, or yeah.
Yeah,
Is it
already, yeah.
Is start?
You start, yeah, already start, because this is the president already to give the new regulation, president decree number 72 2021.
Okay, yeah. So
And
very
then we start
interesting.
now, yeah.
Yeah,
Yeah, because we look at this the action plan from the BKKBN still in progress.
Okay.
Yeah, this is the good effort, Pak Adrian. Yeah, because family planning long time ago successful with the
with the 2 children in 1 family program.
Yeah. This is the campaign from the behavior change communications for the for family. I hope, yeah, because I hope, yeah.
Yeah, let's see, because everything still can happen. I would say. Okay, for participant, please, if you have any further questions, you can type. Okay, this is our first question. I think from Evi from University of Indonesia. Dear Mr. Doddy, dear Pak Doddy, thank you very much for a very insightful topic. As you have mentioned previously about wasting, in addition to stunting, could you please to give us an advice about the effectiveness of intervention for wasting reduction in Indonesia? That's the first question. So could you please to give us the insight or advice about what is the effective intervention to reduce the wasting prevalence in Indonesia? And then second question from also from Evi, and from your perspective as a representation of government, and also former of the director of community nutrition, could the multiple micronutrient supplementation, again, multiple micronutrient supplementation for pregnant women become maybe an effective intervention to prevent the wasting in the children?
Yeah, thank you, Bu Evi, in your questions. We look at this to first in wasting. At the end with the I'm a former director of nutrition already to one program to the tackling with the wasting. The one program is we want to the ready to use for the food. Yeah, this is important things with the community mobilization, the guideline, and then the program strategy with the UNICEF together. We already now we still progress with the RUTF in Indonesia from the local food. Yeah, I hope.
Okay.
I hope in the December already reproduced. This is the still research in the with the efficacy from the RUTF, because RUTF, this is the for a long time ago with the Bali Bangkes already to develop the program, the program. However, not the finalized the product. This is important thing from the wasting program. Wasting program, this is we look at this posyandu. This is the screening with the underweights and the wasting. Yeah, because this is the acute program, and then must have the food from the wasting. Yeah, this is the important thing. I hope in December we have the finalized the product, and then with the multi micronutrient supplementation. Yeah, I agree. Yeah, iron folate acid. We look at this a lot of problem. Yeah, for, if I'm the former director of nutrition, I want to. It's very difficult to program the iron folate acid. We have already changed the. I already to change the product. Yeah, this is the good product, and then we changed the ministerial decree. I changed the strategy for program. We chose the adolescents. It's very difficult to iron folate acid because many things the journal and research in the world a program the iron folate acid is very difficult. The volatile program, yeah, I agree, and I hope with the multiple micronutrient supplementation, I already to invite with the many things the program to discuss with academics, policy paper academic, working paper academic together with my office. This is important things because my office is for a long time with the research and development program. I'm waiting, yeah, because for example, like RUTF, RUTF already we start to 2020 because the pandemic COVID, we close and then open again to the sampling in the wasting babies to the in Bogor. And still progress, the good progress now. Thank you very much facilitation with the UNICEF and the expert with my researcher in the Bogor.
Yeah.
Itu Pak Adrian, Bu Evi.
Yeah. Thank you very much for the answer, Mr. Doddy. So yeah, actually our Department of Nutrition, Faculty of Medicine is also one of within the team in collaboration with UNICEF recently working to address the stunting problem. And yeah, this is part of also the collaboration between one sector to another sector within the government body. And we go further to the second question, I think from Sunya. Is there any action taken by Ministry of Health to cooperate with other minister to address stunting in Indonesia? Perhaps you may give the example, Mr. Doddy. For example, one minister and another minister, and what kind of program has been developed, and what kind of result, maybe?
Sunya from Undip. Yes. We want to the other ministry because now to cooperate with the ministry and agency 24 now. Please, never mind, because the innovations, the President Decree number 72, this is the new, this is the new President Decree. The different with the number 42, only nutrition aspect. In the new regulation, this is the multi aspect, the innovation, the research. We have the strategy. Yeah, for example, this is the example like this. On to the program with the convergence. The convergence. From the central government
program.
Yes, and then to go to the province and district and city until the villages. In local specific local. Research to increase.
Okay. Thank you very much. And we have a raised hand from Odilia Rondang. Perhaps you can further ask to Mr. Doddy.
Yes, good afternoon. Thank you very much, Pak Adrian, for the opportunity. May I ask you, Pak Doddy, for one question? One of the stunting intervention in Peru is giving money to the poor to reduce the poverty, and then decrease the stunting prevalence. In Indonesia, this is also done, such as BLT, Bantuan Langsung Tunai, Program Keluarga Harapan, and then Kartu Sembako, and also Kartu Prakerja is the newest bantuan from the ministry. However, is cash transfer actually effective for the people in Indonesia? Because we find it difficult to check whether the family use the money for food or educational needs or for the other things. Or there is actually a tracking system for using cash. Why we cannot give like a rice or an egg or just like quota for us mahasiswa, we give in quota or something like that. Why must cash money? Thank you very much.
Yeah. Yeah, thank you very much, Audelia. This is the political, Audelia. Before already to buy an egg, a rice, many things. However, to corruption. Yeah. Indonesia, I don't know with the, you know that the situation, the corruption. Yeah, because I'm all meeting with the Ministry of Social before. Yeah, because we give the rice fortification. I give informations. I give the many things, the good food from the buy. Yeah, for example, like egg, fish, yeah, and cold chain, many things. I give the money per month only from the pregnant mother. Already many things. Yeah, problem with the corruption. In Peru, no political. Indonesia political. Yeah, because I was in Peru. Yeah, I look at this in the in the country, in the central government, go in the village. Look at this. Yeah, they're very altruistic. Yeah, and then important things in the Peru, in the social society organizations. This is important things. I hope we look at this to the program. Yes, this institution of the social society. This is important thing to look at this the program. Like Audelia from information from me. Why this different BLT in Peru, Indonesia? Yeah, because we problem with the to give the intervention directly from the people. This is a problem. Yeah, because because I'm already discussed with the Ministry of Finance. Yeah, because Ministry of Finance give the incentive for the innovation with the in the village, innovation with the district for the program. Now we look at this. For example, in Peru, the budgeting, all monitor with the Ministry of Finance. Indonesia no, because Indonesia decentralization. Yeah, this is the different. And never mind. Or yes, this is the one struggle with the because we look at this. Yeah, for a long time ago we already to discuss with the political party. Education and health, no decentralization, must from the central government.
Mm-hmm.
Yeah,
so I think regardless that Peru, we can learn something from there, but actually the implementation is not as the same and as easy as what have been seen there, right?
The program same. The program same.
Yeah, but the implementation.
We're waiting 2040. We're waiting to 2024, 40%. This is the remarkable from the Indonesia to successful
remarkable or target.
Yeah, target. I'm still the I'm still the behind of the sign because I'm the former director to initiator with the stunting program first in Indonesia. And then to move in the because 6 year I'm former 6 year and I'm director of nutrition and change to my position still public health effort, public health and then communicable disease. I'm still meta analysis from the many things program. Yeah, not only with the food, we look at the infections. Yeah, for example, gamma from Japan, is there a possibility micro a sort of protein? Yes, because I'm already to develop with the Ministry of Fish.
Okay. Yeah.
Because already
to develop the RUTF, right? So gamma from Japan actually Mr. Doddy just recently answered your question. Is that any possibility of microalgae as a source of protein or for supplement? That's possible,
Yeah,
right?
possible.
Because yeah, Mr. Doddy just mentioned that we already collaborated. Yeah.
I'm still
And
research
also
in that.
one of our lecture in the Department of Nutrition, Mr. Nuryanto, I don't know if he is present here. He has a project and he is creating the RUTF, what one of what Mr. Doddy has been discussed right now. I'm not sure if he is present in this discussion.
Yeah, this is the good question from Octavianus. Why MOH doesn't develop real time? BKKBN combined. BKKBN already combined. Yeah, responsible from the midwife and the nutrition in the village. Still responsible because Minister of Health are responsible from the specific intervention.
Okay. Thank you, Mr. Doddy. And one more question from Marina Hardianti. She is from Karolinska Institute from Sweden.
Oh yeah.
So yeah, she asks. Okay, thank you, Pak Doddy, for the presentation. It's good news that Ministry of Health will be collaborated with the Ministry BKKBN or Family Planning National Agency to tackle the stunting problem in Indonesia. She has some questions that first, as I heard before, you said by several months, the data collection of anthropometric recently will be started soon. So her question in how that could be done considering the COVID-19 situation. So that's the first question. And then the second, in her view, in her point of view, that Ministry of Health has been developed plenty good strategic guidelines, which has complete information and solve maternal health and child nutrition problem. But somehow the guideline is too complicated to be understood by general people or general lay audience, I would say. So how does Ministry of Health try to disseminate the guidelines to make it more simple for general audience? I think that those two questions are interesting. Please, Mr. Doddy.
Yeah, thank you.
Marina,
from
Karolinska Institute.
Karolinska, this is the I already 2 times in the Sweden, the nice country. We look at this. This is a good effort from the BKKBN. Yeah, we already to discuss with the BKKBN. We look at this many things. The guideline from the people. Yeah, the literacy from the nutrition and health. This is important things. Yeah, I'm so long in the Ministry of Health. Yeah, since to 1997, we look at this very complicated guideline from the Ministry of Health. I hope the BKKBN we already discussed with the many things my colleagues in the BKKBN, and then I give my guideline too simple because I'm already to research to what can do with the understood with the people with the program. Yeah, because the program in the family must know with the what can to implement in the family in the household, for example, like that. Why BKKBN President chose to responsible with the reduction for acceleration stunting? Why? Because the BKKBN, the program, the family. Yeah, before Ministry of Health only for a long time finished in the primary health center. Many things the program, many things the money go in the primary center. However, primary center is different now and last. It's different. For a long time ago, primary center. Yeah, I was work in the primary center in Aceh in 1985. until 1980 age. 3 years I was in the primary center. I give the education, educate to the people. However, now many things that change the primary center now. Many things, not enough time to go the family. This is the president now. I hope this change, because all the flop, the educated, the guideline, the simple guideline, yeah, because the BKKBN want to develop the card. I think the English is local genius. I think the supporting for the family. Yeah, the last my presentation. Yeah, the mental models. This is the lecture. What next? What next? The presentation. What next? The output with the lecture. We want to clearly with the iceberg model, the mental model. For example, like for a long time ago, we already programmed exclusive breastfeeding, eat iron folate acid. However, not eat, still anemia. This is the Marina.
So,
good.
Yeah.
I think I'm agree with the.
So the adherence might still the problem. The adherence of mother to consume the iron pills. And then the second question from Marina about how technically what would be done to measure or to do anthropometric measurement in this COVID-19 situation, Dr. Doddy.
Oh yeah,
so,
yeah.
How to implement? What is the strategy or something like that?
Yeah, because I'm the health protocol. It's very full health protocol. Yeah, because before my task to start the research in prevalence of district and city. However, not enough money, and then I changed the provincial prevalence and national prevalence. Still in progress. Yeah, we develop the protocol. Health is full protected. Yeah, for example, we have started the pandemic COVID because this is important thing. Yeah, because my colleagues in the hospital, primary health center, to directly face to face with the positive COVID. Why not may not implement the research? All the UN system not obligation for research. I go to research. Yeah, we argue with the committal clearance. Why? Yeah, because this important thing. We want to know with the under 5, under 2, the pregnant mother, and then we have the data 2020 determinant of the determinant for the factor with the babies under 5 in Indonesia for protocol health protocol. I have the data. Yeah, because this is the base for me, because I want to know the situation 1 year. Yeah, and then 2001 we still progress, and now until now 80% response rate for the national prevalence. I'm waiting the prevalence, and then I go to the prediction prevalence stunting district and major. Yeah, this is a health protocol complete. Yeah, PCR, RDT, many things. Is the positive? Yeah.
By implementing the health protocols massively to the field, right?
Yeah.
Yeah. Okay. Next question, and maybe perhaps the last question, because our time is quite limited. From Maastricht University, from Jelle. I'm sorry if I'm pronounce it wrong. From Yale, from Maastricht University Biomedical Sciences. So, dear Dr. Doddy, thank you for your lecture. I have a question with respect to the stunting management approach. The population size is increased annually, So the population in Indonesia is increased annually, and this may lead to more difficult with the equal distribution of nutrition over the population, and it also may lead to increase the poverty. So I guess this would be disadvantageous with respect to stunting. So how can the stunting management approach cover the increasing of population annually and also the equal distribution of nutrients over the population?
Yes, yes. Yeah, this is the good question, Adrian. Yeah, because yeah, we look at this the guideline from the activity with the Posyandu, integrated outpost, primary health center. Yeah, we already we have a good research. Yeah, in with not the with the Google form. Yeah, with online. Yeah.
Okay.
Yeah, we
EPP
already.
BGM you mean?
Yeah, yeah.
Okay.
Yeah. The data, because we
the data.
look at, we look at this the questionnaire, and then the data from the electronic from the EPPGBM. This is overall to cover, to program.
Mm-hmm.
Yeah, because we problem to tackling with the negative or positive COVID. This is very difficult. Yeah, from the babies, from the children, from the pregnant mother. This is the very because I have the data. From data pregnant mother to infected the positive to the baby, what can do in the activity. Yeah, okay. It's very difficult. I think in the work too difficult to the problem. And now already to meta-analysis the data, what the good effort, what good effort with the vulnerable people, okay. Especially for the small area, the small area, because the Bali Bankes have the receive laboratory, all the sample to laboratory to network with the Bali Bankes, the hospital, and then to look at this item with the activity.
Okay.
Yeah.
So maybe what has just what has been explained by Dr. Doddy is just first integrating all aspect within the coordination of Ministry of Health, and also the second one is the decision of our president by involving of family planning national agency, which this agency 10 years ago, they did a really great job by implementing one family, two children in Indonesia. Maybe this combination could do some good programs in the future to maintain the amount of population, which of course increase annually, but not quite stiff the increasing. So I think that I hope that answer your question. And I think we already in the end of presentation, Mr. Doddy, very interesting talk from the perspective of government and also the evidence-based results that have been used to develop the program, to develop the strategy to tackle the stunting. And thank you very much for all participants for attending this course. And we will see in the next schedule. So maybe before we can take the picture together. So please open the camera if you are still switch off your camera. Reza, could you please to help me to take a picture together?
Okay, Dr. Adrian.
Thank you very much, Reza.
For all participants, please open the camera for the documentation. Thank you. Okay, please waiting because we have 5 slides for capture. And don't forget to give your great smile. Wait a minute, please. Okay, thank you so much. All is done, Dr. Adrian.
Thank you very much, Reza, for your assistance, and thank you for all audience, all participants. We will will keep inform you with the updates from this lecture. Actually, to be honest, we still have technical issues with regards to the MOOCs platform, but we are currently working on it to make it safe while we can access this, right? So thank you very much, and stay safe and stay healthy. I'll see you in the upcoming schedule. Bye.
Bye.
Thank you, Pak Doddy.
Thank you very much, Mr. Doddy.
Yeah, thank you very much. See you.
Bye.